Find great deals on villages for sale, as well as our new statewide classified, Florida for sale. Log on today and post your free classified. You'll reach thousands of shoppers who check our listings every day. Are you a business looking to get a corner on the internet marketplace? USA for Sale can help you reach your target audience in Ocala, the villages, and statewide. There's no better place to reach shoppers than right where they shop. Let us show you how. Learn more by calling 352-629-1663 or visit us online at usaforsale.com.
All right, 5 minutes after 11 o'clock. Thank you for tuning in. Robin, you and I were doing a video promotion for something one day, and I must not have looked at you when we were doing it. And then when I looked at during the editing process, I was looking at your face, and I said, I wonder why Robin's talking like a pirate. I thought you were talking like, you were going, and I'm thinking, oh, how did I not notice that? And then when I saw you the next day, you still had the droopy left side of your mouth, or right side. Which was it, left side?
Yeah, I think it was the left side.
And I said, Robin, are you okay? What's going on? And you said, I don't know. And then, of course, you called the nurse hotline, and they said, get in here right away. And we were scared that it was a stroke. Mm-hmm. And gosh, we waited a whole day. We didn't know. And so knowing what to look for is important. The good news in your case is it was not a stroke. It was Bell's palsy.
Yes.
Am I remembering it right?
Yep.
But still, that was one of the risks. They pulled you right in there. They knew who you were.
I know.
It's nice to be famous. You walked into the hospital. Robin, come in here right away. Larry, you sit down here. You're not allowed in.
Yeah, right?
Yeah. But anyway, it's important to know the science. Oh, my gosh. Dr. Patrick T. Ellinor is on the phone. He's a cardiologist. He's the director of the Cardiac Arrhythmia Service at Massachusetts General Hospital. He's got all kinds of credentials and very little time to talk about something very important, the signs and symptoms of atrial fibrillation and the warning signs of stroke. Good morning, Dr. Ellinor. Thank you for being on the air with us today.
Oh, it's my pleasure, Larry and Robin. Appreciate your time.
Are you in Massachusetts right now?
I am indeed. It's 40 degrees, raining and beautiful.
Wow.
40 degrees, raining and beautiful. Well, it's like 70 here, sunny and beautiful. So just
I know. I was in Orlando last week.
Oh, okay. Well, I don't know. Did you hear my intro? Hopefully you did. Robin had the Bell's palsy thing, and we were scared that it was a stroke, and we would have been really bad off if we waited a whole day, right? If it was a stroke.
Absolutely, and you bring up a critical point, which is the American Heart Association has a quick way to remember how to spot a stroke, and they talk about spotting a stroke FAST, where FAST stands for face drooping, so just what you talked about.
The first thing she had, yeah.
First thing she had. Second was arm weakness. The third is speech difficulty, and then the T says time to call 911 and not to mess around with it. So,
yeah, really?
You have any of those symptoms. Bell's palsy is something else that, as you know, can cause facial drooping. But most important thing is make sure it's not a stroke and react to it just like you did. Get in there and get checked out.
Okay, so let me ask you this: when we hear about the three things that spell FAST, face, arms, speech, and time. In her case, it was just face. So could we have written it out? What do we do? I mean, I would go anyway. I would say, oh, you got one symptom, right?
No, you get any of those top three, you go straight in and get checked out.
Okay.
If it's something easier and less dangerous than a Bell's palsy, then that's fine. But you don't want to miss a stroke because time is critical to protect the brain.
Oh my gosh. Okay. Well, that was lucky for us. It was just a Bell's palsy, right?
Yeah, I thought it would go away. I don't like going to the doctor.
All right, so can I ask you to give us like a kindergarten lesson here on AFib? What is it? It says atrial fibrillation. I mean, I know what it stands for, but I don't really know what that is.
Sure. Let me give you a little background. So atrial fibrillation, or AFib, is the most common irregularity of the heart rhythm or pulse. Nearly 3 million Americans have AFib, and it gets more and more common as you get older. So normally when your heart it beats, it contracts and relaxes in a nice, smooth, and steady fashion. And the way that the muscle is triggered to contract is with a tiny electrical signal in the heart. And those electrical signals can be picked up on an electrocardiogram or EKG in your doctor's office, and they can see, is the electrical signaling normal or abnormal? Now, when you're in AFib, the top two chambers of your heart aren't beating normally. Instead, what they're doing is beating chaotically, very quickly, and irregularly. And then the muscle stops pushing blood through effectively. Blood can pool, that can form a blood clot. Those blood clots, if they break off, can get pushed out of the heart up into the brain and cause a stroke.
Oh my gosh. Okay, so that's the connection between what you're talking about and the stroke part of it. So, so do we have a way of knowing that that's happening? Do we feel it? Is there a sensation that we can identify?
Yeah, you bring up a great point. If you're younger, you tend to have more symptoms of AFib, and those tend to be rapid palpitations or a racing heartbeat. They might be lightheadedness or dizziness or fatigue. But as you get older, unfortunately, many people may not have any warning system at all, and that's why having a regular checkup. This is something you can detect as easily as checking a pulse, listening to a heart, or then having an EKG. So going in for those regular checkups, that's the most common way that we pick up episodes of AFib.
Well, sometimes people need medication to regulate their blood pressure, and then they have to keep going back and forth to the doctor to get the proper dosage. Is there a danger that AFib can happen during those times?
We bring up a couple of important points. One is that AFib is one of the, in addition to age and just getting older, one of the big things that can increase the risk of AFib is uncontrolled blood pressure. So make sure to keep going for those visits to get the blood pressure under control. Other things that can lead to the increased risk of AFib are obesity, sleep apnea, excessive alcohol use, and those are the types of things that we can try to modify. So healthy diet, exercise, losing weight, stopping smoking, all of controlling the blood pressure are all things that you can do to prevent both AFib and stroke risk.
Really? Okay. So, but do you any problems that we may have caused by being obese or by smoking? Do they reverse themselves when we start to clean up our act?
Yeah, there's great data that on both of those topics. So stopping smoking, which is tough. I mean, it's not easy to stop smoking, but folks need to try it and then keep at it. Right. Can actually, a lot of the dangerous things, both for the risk of heart disease, stroke, and lung troubles, can be reduced if you stop smoking. Same for obesity. Can lower the rate of blood pressure, diabetes, heart disease, and AFib and stroke, all with reducing your weight.
What about people that have been diagnosed with cancer and they've had to have a part of their lung removed? Are they a candidate for AFib?
They certainly are. That's a more unusual circumstance, but with any kind of chest surgery, there's an increased risk of AFib, although that's rare in the general population.
So when you see this, when you see symptoms of AFib, then you automatically know that the patient might be a candidate for a stroke. I'm just probably asking a question you already answered, but I'm just trying to make sure I understand it.
No, I think you're making an important connection, which is that when you have AFib, the first thing is to recognize it so that you can get on the proper treatment. It's important to realize with AFib, your risk of a stroke is 5 times higher than somebody without AFib.
Oh, my goodness.
So dramatic increased risk. But the good news is, out of all of this, is if you can recognize it, you can reduce that 5-fold increased risk down to the risk in the general population if you take the appropriate treatments, which in this case, the most important one to prevent a stroke is really being on a blood thinner to prevent those blood clots from forming.
Oh, okay. And that's a prescribed blood thinner, or is aspirin good enough?
No, aspirin's not good enough. There's pretty good data that aspirin alone is not good enough for AFib, and that really for the vast majority of people, a stronger blood thinner is necessary. There are a lot of new choices. So the most common blood thinner used to be warfarin or Coumadin. A lot of us had, grandparents that were on this, but there are at least 4 new drugs that are out there now that are much easier to take, they're safer, and they're more effective.
When a person has a stroke, do you think that stroke could lead to them being in a coma? And then do you think they'll be able to come out of that coma?
Well, strokes can, and strokes due to AFib tend to be more dangerous because strokes that occur because of a blood clot tend to be big strokes. And sometimes the symptoms are reversible, but many times they're not. And so that's why what we're really trying to do is we ideally want to prevent that stroke from ever happening to begin with.
Let's make sure we can leave the listeners with some research opportunities or information. Our website usually fits the bill there. Do you have a website you can tell us about, Doctor?
Absolutely. The American Heart Association has a lot of terrific information, and you can get to their website at heart.org/AFib awareness, or folks can type into any search engine American Heart Association and AFib, and it'll be one of the top choices right there for them.
Okay, very good. Dr. Patrick Ellinor, thank you for being on the air with us today. Important stuff, and we will forever remember FAST, face, arm, speech, time. Gosh, good information. Thank you, Doctor.
My pleasure. Have a great morning.
We will be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. On this Wednesday, sunshine, some clouds, and warm. High 79 to 83. Partly cloudy Wednesday night with a low of 56 to 60. There'll be some fog in the area late Wednesday night into Thursday morning, and partly to mostly sunny and warm later Thursday with a high of 78 to 82. Friday, partly sunny and warm, high 80 to 84. From the Florida Weather Center, I'm meteorologist Joe Lundberg.